do we got?
Nathan Clay, 58-year-old male, peds versus auto. GCS 12, vital stable, gross deformity to the left upper arm.
Right in here.
Complains of chest and back pains.
Mr. Clay, can you hear me? Mr. Clay? I'm on count. 1, 2, 3. Airway's intact. Breath sounds clear bilaterally. Ow! Tenderness in the left chest and thoracic spine. What happened here?
He's walking with his wife on Michigan Avenue, suddenly flips out, starts wailing on her. A couple Samaritans jump in to help out. He takes off, right into traffic. Score 1 for Karma.
12 lead EKGs, chest x-rays, CT of the chest, abdomen, and pelvis with recons of the TLS spine.
On it. No, leave me alone. I'm fine.
Laura Clay, 55-year-old female,
I'm fine.
GCS
I need to get to my
15.
husband.
Ma'am. Okay.
Heart rate's tachycardic.
This is all my fault. Look, I blocked my fall with my hand, not my C-spine. I'm neurologically intact.
Technical, are you a doctor?
Yes, I am.
Dr. Rhodes?
Honey, no, I'm right here.
Hold on.
There are too many of them.
I'm here, my love.
I need restraints, 2 of Versed, 5 of Haldol.
No, not Halidol, quetiapine. He's not abusive. He has Lewy body dementia.
Big scratch of Haldol. 25 of quetiapine.
It's all right, my love.
What the hell's Lewy body?
Debilitating form of dementia. Alzheimer's meets Parkinson's.
In the beginning, I wanted to think it would pass. Any wife would, but I'm also a neurologist, and I couldn't ignore his symptoms.
Oh, so you diagnosed the Lewy body dementia?
Yes, but I got a second and third opinions, and they both agreed it was LBD, and that was about 4 years ago.
4 years? Really? You know, Nathan expressed deep regret to me about the pain that he's caused you. That kind of insight is rare for somebody who's been battling LBD for that long.
Well, my husband was an engineer, and his brain is wired to solve problems. And last year, I retired early. I wanted to devote more time to his cognitive therapy.
Well, it's been working.
There's moments when he's lucid, but more and more is this.
Mrs. Clay, Nathan's latest EKG is still normal. I want to do another one in a few hours, but if it is good too, I'll discharge him.
Thank you, doctor. I know that it would be better and safer for the both of us if Nathan went to a care facility. But if I do that, then it's over. I'm not ready to give up our Sundays listening to opera. I know it's hard to imagine, but my Nathan is still in there. Last week, he made me dinner. Florentine lasagna.
He can still cook?
Well, meals take longer to prepare than they used to. But he does it for me. He's fighting just as hard as I am. Okay, honey, 8 across. It's 5 letters, and the clue is rental agreement, and the first letter is L. I'm thinking the second is E.
L-E. Lease.
Good, honey. All right, next one. We're gonna do 23 down, 6 letters. The clue is collects with an S.
What happened?
I don't know, his blood pressure tanked.
All right, bag and hang a liter bolus.
Yes, doctor.
Sets are dropping. Intubate?
Yep.
Grab the bag and hook it up to the O2.
All right, 20 etomidate, 100 is sucks. Let's bring in the fast scan. April, give me some pressure.
Here, doctor.
And I'm in.
Got it.
Okay, scan.
Here you go. Heart rate 110.
All right, belly's clean. Poor wall motion of the LV and a small effusion.
He's bleeding internally?
Dr. Charles.
Mrs. Clay, please.
Stats are back up. Oxygenation improving.
It's not gonna matter if he goes into cardiac arrest. CT of the heart and great vessels. Let's get him ready to go.
Cath lab for a cardioangiogram?
Should give a better view of Nathan's pseudoaneurysm and hopefully help me estimate a timeline for his wife.
You mind grabbing me an MRI of his head while you're up there?
Brain scan. His injuries don't necessitate it.
Not for him, it's for me.
Dr. Charles.
Dr. Rhodes. His awareness and gross motor skills are just too strong for somebody who's been battling LBD as long as he has. No amount of cognitive therapy in the world is going to outthink this disease to the degree that he appears to be.
Laura and 2 other neurologists have all agreed on the Lewy body diagnosis. You think they're wrong?
I don't know what to think. That's why I need the scan.
Might need the wife's consent.
Hasn't she been through enough? I'm just trying to spare her some false hope here.
Hello.
Gentlemen?
Jake O'Day isn't exactly the time to be sneaking in unauthorized tests.
I don't know what to tell you.
Okay.
Thanks, pal.
I don't understand. There should be atrophy, heavy degeneration, tangled cells in the white matter. When was this taken?
About an hour ago. I'm sorry, I had a hunch. I rushed it. I really should have.
That is a healthy brain. There's no disease. This means that
Nathan doesn't have Lewy body dementia.
he has the symptoms. Keeps getting worse, practically a textbook case. How?
Take a look at this cross-section we took during the MRI. And notice the adenoma, benign tumor, in the parathyroid gland.
So you think this is all hormonal irregularity?
Elevated parathyroid hormone is consistent with increased calcium and cognitive impairment. Nathan has both.
Yes, but he also has hallucinations, physical aggression. You don't see that in patients with hyperparathyroidism.
That's where his recent bypass surgery makes him unique, okay? The beta blocker he's been taking ever since causes increased levels of violent behavior in a select amount of patients.
Oh my God. A hormonal imbalance with a medication side effect. Why didn't I see that? The clues were right in front of me.
Because they mimic the symptoms of Lewy body dementia to a T. And 4 years ago, that adenoma would have been so small, no scan could have caught it. Look, I'm just telling you that presented with the same evidence, I would have done exactly the same thing, reached exactly the same diagnosis. Anybody would have.
You didn't. I did. And if I had caught the PTH 4 years ago, Nathan doesn't run into traffic, doesn't get hit by a car. Today never happens. He's dying, and it's entirely my fault.
How's he doing?
Well,
Good. How are you doing?
as a neurologist, Lewy body dementia was my worst nightmare. I'd seen so many cases, and I'm wondering if it influenced my diagnosis.
Medicine. You know, imperfect science, practiced by human beings, no less.
4 years, we could have been doing CTs. But I had an answer, so there was no reason to continue radiating his brain. I robbed Nathan of his mind, imprisoned him. I drained our savings, squandered our time together, time that we can never get back. How am I going to tell him what I've done? He's never going to forgive me.
Your husband's going to forgive you, Laura. I want you to trust me on that. Your struggle, if I may, is figuring out how you're going to forgive yourself.